So we are very happy to have here with us today Dr. Dodell. We welcome you here in this first symposium in Greece about weight bias, and it is a great honor to have you with us. As we were thinking about the guests, the speakers, honestly, we could not imagine of a more suitable person to talk about weight bias rather than you. So we're very, very excited. We want to listen to you. And the first question that we would like to ask you is, what did initially urge you to start caring and focusing on weight bias as a doctor and talking about that?
Good question. And thank you so much for having me. I wish it was in person because Greece is beautiful and I would have loved the opportunity to be there with you all. What got me thinking about it is I'm fortunate enough to be married to a psychologist who came across health at every size and was hearing from her clients over and over again. I mean, she trained in the bariatric surgery world and was working with people with emotional eating and things like that. And she was seeing what was going on with her clients, and she came across HAES and introduced me to it. And just from talking to her and hearing from patients really what their experience has been in the healthcare system that we currently work in, I recognize that maybe there's a better way, certainly for the patients that I was seeing. And that's why I started really getting interested in it and kind of diving into the social media world and learning and reading the research papers on weight stigma and weight bias and the detriments of weight cycling. And it's an ongoing education, but I could say that from practicing from this standpoint, I'm really seeing a difference in how I work with my patients, and also I think their willingness to kind of work with me, and it's been really nice and fulfilling to kind of change this perspective on how I look at the metabolic endocrine system.
Based on your experience as an endocrinologist, how can weight bias affect patients' health?
So we see and we hear in the research, I hear from my patients, and the research and all the surveys are clearly out there that people avoid seeking healthcare when they've been subjected to previous experiences of weight bias and weight trauma and things like that. And unfortunately, it starts very young, even as children, the diet culture and the recommendations from clinicians that they need to change their body and diet and all these things. So based on that, I mean, people avoid going to doctors. So that's number one, is like creating an environment that people want to go and seek care. And if their goal is health, and to feel like they can seek that out and go talk to a clinician who's going to work with them and not make them feel bad about themselves. Number one, we know also that people avoid physical activity, going to the gyms, going out and moving their body because of all the perceptions about weight that are out there, globally. So all these factors affect people's health. And then we know that living in a larger body creates, systemic hormonal inflammation and higher cortisol levels and all these things because of the stress that these people have been reported to have, in research studies. So all these factors certainly play a role. And that's why when you look at the studies on weight, there's no causation between weight and diabetes and blood pressure and cholesterol and all these things, unless you can really tease out and control for the fact that the stigma and the bias and not wanting to go out and see a doctor or move your body, all those things affect health. So yes, there may be correlations involved, but you can't say the weight is causing these things without really looking at the lived experience, of these people.
That's honestly so moving. I think that people who are going to listen to that, who have such experiences, are going to be touched and acknowledge their experiences. Honestly, I'm very happy about that.
I hope so. It's really eye-opening, as I started practicing this way and continue to practice this way. It's really so heartbreaking to hear, that people sit in front of me in my office and tell me, how they've avoided going to the doctors, or that they've gone to sit in their car or gone out on the street, most of the time crying because of the experiences they've had. And I want to be clear. I mean, I know, and I would say, confidently, that clinicians not intending to do any harm. That's the way we are trained, is like, you know, it's unhealthy to be in a larger body. So it's on us to try and help people lose weight and be healthier and things like that. But in a lot of ways, most of the ways, it seems counterproductive. And I think that's why the discussion is changing, you know, across the board. You know, the societies that focus on these things are acknowledging the detriments of weight stigma and all these things, and it's real. It's just a question of what do we do with the fact that that is creating more harm than good for people.
So based on that, I also think that some common myths around weight perpetuate weight stigma. So I would like to ask you if there is any specific myth around weight and health that you find it very dysfunctional and you think that it needs to be reestablished.
I think it's so harmful, the assumptions that people make based on just looking at someone. You know, assumptions in general, whatever the subject matter is problematic, but certainly with regard to weight. I mean, so many people tell me that people just anticipate and expect that someone in a larger body is not exercising, they're not moving, they're sitting around not eating what we call, you know, healthy foods. And that's just wrong, because a lot of the times the people are moving their bodies and they're active and they're eating their fruits and vegetables, and there's a tremendously high percentage of people in larger bodies who have eating disorders and they're restricting their calories, and they're in a larger body because that's their body and that's genetics, and making those assumptions is really problematic. So I say, you know, part of a history, a good medical history, is asking people, like, how much are you moving? What, you know, are you getting fruits and vegetables? You know, do you have any history of disordered eating? All these things are important to flat out ask. You know, don't make any assumptions about anyone. And, you know, research on medical students, I believe out of the US, said even in the first year medical students that they assumed people in larger bodies were not going to be as compliant with taking medication, that they're going to be lazy, that, you know, they don't want to be healthy, whatever these stereotypes and assumptions were. And then it just gets perpetuated over time by, you know, society, and that's not good for healthcare or, you know, people.
Yeah, so important that ask.
Straight up ask, yeah, and
just ask.
And therefore, you can't assume that someone in a smaller body is exercising and eating all the things that we know nourish us. So, you know, body size is not a diagnostic tool for people's behavior.
I was thinking that, as you mentioned before, nobody wants to harm their patients, but what would you suggest to a healthcare professional to do in order to challenge their own internalized weight bias?
I think, you know, looking at the research is really important, and I kind of started doing that, I don't know, a year or two ago, when I started getting interested in changing my perspective and my approach to patients. The research on weight stigma and weight cycling, and even the research on just increasing physical activity independent of any change in weight, all that research, you know, major journals will tell you that, okay, you know, something has to shift in the way we're approaching weight and how we treat these people and treat these patients, and that people across the size spectrum can benefit from healthy behaviors, even if their weight doesn't change. The weight, of course, may change, but weight's not the behavior, right? The behavior is how much you're moving, your sleep, your stress management. Weight may change as a result of those things, but it also may not change. But the markers and the metabolic markers that we look at will likely improve. So I think that's important, is look at the research. You know, that's the research is what got us to where we're at as far as our current approach. But look at the research, you know, on the other approach and see that it's validated and it's real, and that's important.
This is a strong tool. Just the research and then ask, I think.
Yeah, ask. I mean, you know, research is great and it's important, of course, but we don't treat a population, you know, we're taking care of someone, we treat that individual. So like what may work for one person may not work for another. So yeah, of course, there's patients that benefit from, you know, with diabetes who may do very well with a specific type of diet and eating pattern, but that may not work for another person.
Yeah, of course.
Very, very interesting, honestly. Focus on the behavior. So the last question that we would really like to listen to your reply, to your answer is, why do you think, based on your personal opinion and your experience as an endocrinologist, why do you think it is so important to try to eliminate weight bias in healthcare settings?
Part of the reason, or a lot of the reasons, what I started with is, if we want to take care of people, we want them to feel comfortable and come see us. And if they're going to do everything they can to avoid seeing a doctor and doing preventative medicine, that's not really helping anyone, right? And if they don't feel good about themselves and the stress levels are high because of the current approach, then we have to reassess that. And, you know, I think the whole point is for us to be, you know, a community to help people, and that's what healthcare really should be about. So I think asking these questions, having these discussions, not making assumptions about people, it will go a long way.
It was honestly a pleasure for us.
Thank you, me too.
Everything you said was really meaningful and to the point. I'm sure that our participants are going to benefit a lot from this. They're going to listen to things that maybe they weren't aware of. And we are all inspired by such approaches. And it's honestly very, very nice for us.
Thank you. I'm glad we had a chance to talk, and I hope that the symposium goes well and people find it to be useful.
We hope so.
I wish your words inspire other healthcare professionals, because we need more healthcare professionals and doctors like you.
Thank you. Yeah, well, hopefully, you know, this is going to become the norm, and it won't be,
Yeah.
you know, I mean, then it'll just be medicine. It won't be like any, you know, specific, unique thing. It'll just be like, this is how we approach healthcare.
Let's close with that, with this hope, with this vision. And we thank you again for your participation and your great contribution to raise awareness of weight bias among healthcare professionals. Thank you.
Thank you. Thank you very much.